Long lines at testing sites, postponed events, another record high in cases, and a need for more antibodies. Those are just some of the challenges Floridians are facing thanks to Omicron. Thank you so much for watching 10 Tampa Bay this evening. I am Carolina Lee. The good news is that agencies across our area and the state are working on solutions, including new spots to get COVID-19 tests starting tomorrow. This as Florida sees yet another record high for COVID-19 cases, reporting 46,923 new cases today. Our hospitalizations also continue to rise. In the last day, adult hospitalizations have increased by 647, and ICU availability has dropped 3%. Now, these are significantly smaller numbers from where we were in August during the Delta variant's peak. According to the Florida Hospital Association, hospitalizations at that time were more than 17,000, and ICU availability was just under 5%. Pediatric hospitalizations are also up in our state, with 10 more cases compared to yesterday's report. It's a problem that we are seeing nationally. According to analysis from CBS News on CDC data, pediatric hospitalizations in the U.S. are up 30% compared to this time last week. 10 Tampa Bay's Miguel Octavio shares how Omicron is contributing to the spread and what doctors say parents should do to keep children safe.
Courtney Liu of St. Pete remembers the day she got fully vaccinated.
I sat in Publix and I cried.
She was pregnant with her twin girls.
I'm still going to get emotional about it, which is how relieved I was that I was doing everything I could to protect my babies, to protect myself.
Sadie and Zora, now 6 months old, healthy and happy. But months later, the Omicron variant is causing new concern.
A lot more kids are actually getting infected.
Dr. Juan Dumois says kids with COVID are not swamping Johns Hopkins All Children's Hospital, but
we are gearing up for that possibility over the next couple of weeks as the Omicron variant spreads locally.
More cases, more risk for hospitalizations. That's why doctors say it's not bad to test your child for COVID, even with mild symptoms.
With Omicron, there seems to be kind of a scratchy throat.
Other symptoms include fever or a runny nose. While the flu and other seasonal illnesses are here, doctors say your COVID test should give clarity.
They really only need to be tested for the COVID, and if it's negative, one can assume that they have one of the other viruses that are going around.
But Dumois says a trip straight to the ER is needed for more severe symptoms, like lack of oxygen or unresponsiveness. More vaccinations, he says, will be key to prevent these surges. Parents like Courtney agree, so she and her twins can soon be safe.
Just that ability to move forward and be more normal again, and again know that my girls are as protected as I can possibly make it.
Doctors say low vaccination rates among kids are contributing to the spike in cases. According to the last report from the Department of Health, 14% of kids ages 5 to 11 and 58% of kids 12 to 19 are vaccinated in Florida. Health experts say they're worried about kids coming back to school from the break. They stress vaccinations, masking, and good ventilation are key to keeping cases down.